The questions that you should ask when you're in this environment and somebody is giving you recommendations around what to do. I like to empower my patients to become better healthcare consumers. To be a better healthcare consumer, you've got to ask better questions. If you ask better questions, you're going to get better outcomes, yes? What are the risks of this procedure? It's great. That's a great question to ask. The costs. What are the costs involved? See, our society has become drunk with insurance coverage. See, we've lost touch with really how expensive some things really are. If you have a history of having medical care, look at the bills that you received, even if your insurance company has paid for them, so to speak, okay? If you look at what's charged, if you look at the $4,000, $5,000, $8,000, $20,000, $22,000 that we don't even really consider or think about because it's covered by an insurance company. But you know who ultimately pays for that? You guys understand that that's not a charitable organization. You get that? Okay? That just gets spread among all of us. What we've seen is escalating healthcare costs, right? And has everybody's income been running alongside of the escalating costs that are going on around us, right? We've got these escalating costs, we've got these escalating insurance premiums, and they're retracting the benefits, so to speak. And what's interesting is the first things that get retracted are what? Preventative care, you know? Now this hits home with me, because I look at this and I'm like, guys, it's math, isn't it? If you can prevent a $22,000 back surgery by spending $2,000 with a person over a 5-year period just keeping their spine healthy, doesn't that make sense from a business perspective? Okay? We have just become blind to how expensive healthcare really has become, and it's just reeling out of control. So what are the real costs involved? What are my expected outcomes? Because at the end of the day, you want to know what's the net gain, right? What can I expect? What is your definition of a successful outcome? That's a great question for a doctor. You know, ultimately, where are we trying to go? May I interview 10 of your patients? Right? Isn't that a great one? Hold your questions for the end, please, Anna. May I interview 10 of your patients? What I say to my patients is you can interview 100 of my patients. Just sit in the waiting room and talk to any of our patients. You'll see 100 of them just sitting there for 2 hours, right? You can talk to all of our patients. How many of your doctors encourage you to do that? Say, you know, you're recommending this procedure for me. You say this is the right thing to do. These are my expected outcomes. May I interview 10 of your patients? What does the research say? Do you want to be part of an experiment? Do you want to be part of a research program? Or do you want to find out exactly what is evidence-based? What's evidence-based care? What are my options? When somebody's making a recommendation for you to do something, you want to know, hey, what are the options here? What are my choices? Is this the best thing to do, or is this the only thing to do? What are my options? And most importantly, is this treating my symptoms, or is it correcting the cause of my problem? Is this treating the symptoms, or is it correcting the cause of my problem? That's the most important question you can ask in healthcare. Everybody say that with me. Doctor, is this treating my symptoms, or is this correcting the cause of my problem?
Hi, I'm Dr. Jesse Davis. I'm one of the chiropractors here at Franson Family Chiropractic. I hope that you enjoyed that video clip, and I want you to get the opportunity to see what our most successful patient cases have done to get their health back, to get their energy and their life back, to maintain it, and also to increase it in the future. So what I want you to do, follow the link that you'll see here on the screen and on the side of the page. Fill in, when you follow that link, fill in your name, your email address. That way I can send you a link so you can see this whole presentation. So you can go ahead and do that now. I want you to enjoy the video.